So, Rich, how do you develop your investment agenda? That is the areas of investment that you're looking for.
We sit down with our leadership. I think of it as a big funnel. We sit down with our leadership. I call it strategic innovation because it's really vested in our strategy. So what are the things that we're really trying to accomplish? Whether it might be, moving to value-based care, whether it might be greater focus on health equity, whether it might be caring for people in a more accessible and low cost way. I mean, those all have to be vetted and understood with leadership teams and, part of our overall strategy. So that's always step one. And then from there, it's, how do you look in the external world with what's going on? How do you look amongst our own employees? We've had fantastic intellectual property work that we've created things that have scaled across the country. And how do you tap into the VC community, the PE community, other communities, other systems, and what they're doing? And really, when you have those macro themes, ultimately you have to translate that into something that's actually practical and meaningful, whether it's an effort or a partnership or a joint venture or a risk-based relationship or an equity investment. But, to me, it starts with making sure that it's aligned with strategy, and then ends with making sure you're aligned with your operating team, which means you shouldn't, I don't believe in innovation in vacuums. I don't believe in innovation centers that are standoff all by themselves. I think things need to be real and they need to be vested in operations. And so to me, vested in your strategy and vested in your operations are the bookends. And then the middle is how you figure out how to do it, which often requires working with great founders and partners.